Okay, so for today we have a case that was submitted. Looks like for an implant in site number 4 for an immediate placement. So one of the things I always like to do is start with is take a look at what is the best guide solution here, and this is a great case for an OptiGuide. We have 6 natural teeth here in the front that can be used for the integration, but we also have all the teeth in the posterior that cannot be used for integration. So just keep those things in mind. We have a good scan. We have plenty of CEREC data here, so we have everything in place to go ahead and be able to plan the implant. As long as the patient says yes, go ahead and order the guide and move forward. So let's go ahead and take a closer look at our plan here. Here's the implant as it was planned, and I'd just like to walk through step by step what we're looking at here. Okay, the first question I always ask is this a good case for immediate? What do we have to do? Is there enough bone? So what I always like to look at is where is the buccal plate? Are there any dehiscences? So I'll evaluate the case first by looking through my 360 slider here, moving around, and just visualizing where the bone is, where the adjacent teeth are, where the roots are, just all the various things. And looking at it, my assessment is that our bony level is right through there. That our bone goes to about, maybe actually right about here. So our bone goes there, across, and just like so. So with immediate placement, I like to place my implant slightly subcrestal to accommodate for any bone loss that may be occurring. So from that perspective, this plan is bone level wise very good. So I think we're going to be okay there. So the area that I have the most concern about in terms of this particular plan is going to be our occlusal plane and our occlusal table. So in evaluating this, we can see our implant is well centered in the occlusal table here, looking at the axial view. Everything looks very nice there. But in looking at the occlusal plane, what we do see is that our teeth are pointed down like this. So our implant is going to receive forces not on the long axis. So this one would require us to tilt the implant. And as you see, as we tilt that implant, you can see how we're making our occlusal plane better. So now our occlusal plane is becoming more flat and more along with the long axis of the teeth. Now in tilting that implant, what did happen is if we look in our axial view, our screw axis has now gone to the distal. So to correct for that, we have to move the implant back over to the mesial. Now we do have to be careful. Are we getting too close to this adjacent root? And here we look to be pretty safe. I don't want to get much closer than that. So in this particular case, I'll go off plan a little bit and just tilt that back just a hair. So now we have this more in line, not perfect, but more in line with the occlusal plane so we can get nice forces. And then again, if we take a look here, we can see the outline of our tooth, just like so. So we will be getting the implant in some fresh bone here. And then we do need to correct by having tilted the implant for better occlusal plane. We're getting close to the sinus here, so I drop this down to 11.5 millimeter implant. And I think we should be fine in terms of being able to place the implant. One thing that we do need to take a look at, keep into consideration here, is whether or not we'll get any stability. So again, if I come back and draw a line for our tooth, so once we extract the tooth, we need to evaluate how much of this implant is going to be in fresh bone to get us our stability. So in a case like this, my experience has shown that we will get the stability. We just need to make sure that we undersize our osteotomy. Maybe just a 2 drill, a 2.0 drill, or a 2.8 drill, and then place the implant and allow the aggressive nature of the implant to engage into everything. Other than that, I think everything looks great. Thank you for submitting.